Today, we are exploring 9 critical colorectal cancer symptoms that you must never ignore in your life. Colorectal cancer often begins silently, hiding its subtle warning signs until the disease has progressed into a much more dangerous stage. We will break down these 9 symptoms, ranging from the most subtle early indicators to absolute medical emergencies requiring immediate attention. Understanding these vital signs could literally save your life or help protect the health of someone you deeply care about today. Let us dive right into the first early symptom, which involves paying very close attention to your daily bathroom routine habits. The very first subtle sign is a persistent change in your normal bowel habits that lasts for more than 3 weeks. This change might manifest as chronic constipation, where you struggle to pass stool despite maintaining a normal diet and hydration level. Alternatively, you might experience persistent diarrhea, which disrupts your daily routine and completely fails to resolve with standard pharmacy medication treatments. It is incredibly important to track these changes because your digestive system usually maintains a very consistent and predictable daily rhythm. When a growing tumor disrupts this natural rhythm, your colon struggles to process waste, leading to these prolonged and frustrating irregularities. Do not simply brush off these persistent digestive changes as something caused by a bad meal or temporary stress at work. If your bathroom habits remain highly abnormal for over 3 weeks, it is definitely time to schedule a crucial doctor appointment. The second major symptom to watch for is the alarming presence of blood in your stool during your normal bathroom visits. Seeing blood can be terrifying, but it is essential to understand the distinct difference between bright red blood and dark blood. Bright red blood typically indicates bleeding near the exit, which is very frequently caused by common and completely benign bleeding hemorrhoids. However, even if you suspect it is just a hemorrhoid, you should never make that medical assumption without a proper examination. On the other hand, dark or tarry stool suggests bleeding coming from much higher up inside your digestive tract and colon. This dark coloration happens because the blood has been partially digested as it travels slowly down through your entire intestinal pathway. A bleeding tumor located deep inside your colon will often produce this dark, ominous stool that requires immediate professional medical evaluation. Never ignore any form of visible bleeding, as early detection of its true source is absolutely critical for your overall survival. When moving on to the third symptom, we must discuss persistent abdominal discomfort that simply refuses to go away after several days. This is not just a standard stomachache. It includes chronic bloating, severe gas pains, and intense abdominal cramps lingering endlessly. You might feel a constant nagging pressure in your lower abdomen that makes wearing your regular clothing feel incredibly uncomfortable daily. As a tumor slowly grows inside the colon, it can create partial blockages that trap painful gas and disrupt normal human digestion. Many patients mistakenly attribute this chronic discomfort to food allergies, dietary changes, or perhaps developing a sudden sensitivity to dairy products. While occasional bloating is completely normal for everyone, persistent cramps that offer absolutely no relief should trigger an immediate medical warning. Listen closely to your gut. If that heavy, painful feeling inside your abdomen persists, you must definitely consult a qualified healthcare provider. The fourth critical symptom is unexplained fatigue, a profound sense of exhaustion that completely drains your energy despite getting adequate sleep. This is not the normal tiredness you feel after a long workday. It is a deep, debilitating weakness that never improves. You might find yourself struggling to climb a single flight of stairs or desperately needing multiple long naps during the afternoon. This severe exhaustion often happens because a hidden tumor in your colon is slowly and silently bleeding into your digestive tract. Over time, This microscopic, invisible blood loss severely depletes your body of essential red blood cells, leaving you feeling completely drained. Because the bleeding is so incredibly slow and completely invisible to the naked eye, you might never notice it happening directly. And if you suddenly feel constantly exhausted for absolutely no clear reason, this hidden internal bleeding could be the dangerous underlying culprit. This leads us directly into the fifth symptom, which medical professionals often consider a massive red flag: iron deficiency anemia diagnosis. Doctors strongly emphasize that finding unexplained iron deficiency anemia is considered the absolute gold standard for suspecting potential colon cancer early. This is especially true and highly critical for adult men and older female patients who should not be losing blood naturally. When a routine blood test reveals critically low iron levels in these specific patients, doctors must immediately investigate the digestive tract. The tumor acts like a silent parasite, slowly draining your precious iron reserves without causing any obvious external signs of bleeding. Your doctor will likely recommend a colonoscopy to actively search for the hidden source of this mysterious and dangerous blood loss. Never accept a simple iron supplement prescription without first demanding a thorough investigation into exactly why your iron levels dropped suddenly. Finding and treating the root cause of this anemia can dramatically increase your chances of catching colorectal cancer in early stages. Now we enter the progressive symptoms, starting with the sixth warning sign: experiencing rapid, entirely unexplained weight loss in your body. Losing weight might sound great initially, but dropping 10 pounds or more without actually trying is a very serious medical warning. Cancer cells consume a massive amount of your energy supply, actively stealing valuable nutrients away from your healthy, normal body tissues. Additionally, an aggressive tumor can release specific chemicals into your bloodstream that completely alter your metabolism and destroy your normal appetite. You might find yourself feeling completely full after eating only a few small bites of your favorite, usually highly anticipated meals. Furthermore, chronic abdominal pain and persistent nausea caused by the growing tumor can make the simple act of eating feel terrible. If your clothes are suddenly falling off you and you have not changed your diet, please see a medical professional immediately. The seventh symptom is a very distressing condition known medically as tenesmus, which significantly impacts your daily quality of life directly. Tenesmus is that highly frustrating, constant feeling that you desperately need to empty your bowels, even if you just finished completely. You might spend hours sitting on the toilet, straining uncomfortably, yet absolutely nothing comes out because your bowels are already empty. This false sensation occurs because a growing tumor located in the rectum mimics the physical presence of actual stool resting there. The nerve endings inside your lower digestive tract become completely confused by the tumor, sending continuous false emergency signals upstream constantly. Patients often describe this horrible symptom as a heavy, persistent pressure that makes traveling or leaving the house feel incredibly terrifying. Enduring this constant false urge to use the bathroom is mentally exhausting and serves as a major warning sign of tumors. The eighth symptom is a highly specific physical change: noticing that your stool has suddenly become incredibly thin, resembling a pencil. Healthy normal stool should be relatively thick and solid, reflecting a clear, open pathway entirely through your lower digestive tract system. However, as a cancerous tumor slowly grows larger inside the colon, it begins to physically block and narrow the escape passageway, as the waste material is forcefully squeezed through this increasingly tight, restricted space, resulting in stool that looks extremely narrow and thin. If you notice this pencil-thin shape persisting for several weeks, it strongly indicates that something is physically blocking your colon. Do not ignore this clear visual evidence. Your body is literally showing you that a dangerous internal obstruction is currently developing. While other benign conditions can sometimes cause narrow stool, a consistent, long-term change in physical shape always requires immediate medical investigation. Taking a quick look into the toilet bowl before flushing can genuinely provide vital visual information about your internal digestive health. We have now reached the 9th symptom, which is an absolute medical emergency requiring immediate hospital intervention: complete bowel obstruction today. When a tumor grows large enough to completely block the colon, your waste and digestive gases can no longer pass through safely. This catastrophic blockage causes sudden, excruciating abdominal pain that comes in intense, unbearable waves, often leaving patients doubled over in agony. You will likely experience violent, uncontrollable vomiting as your digestive system desperately attempts to clear the trapped contents from your stomach. Your abdomen will become visibly swollen, painfully hard to the touch, and completely distended like a tightly inflated, highly pressurized balloon. A complete bowel obstruction is a highly dangerous, life-threatening crisis that demands immediate surgical intervention to prevent colon rupturing events. If you ever experience this terrifying combination of severe pain, massive bloating, and vomiting, you must call emergency medical services right away. Never attempt to simply wait out this level of extreme pain at home, as every single passing minute becomes incredibly critical now. Beyond these 9 symptoms, it is vitally important to understand the major risk factors that increase your chances of developing cancer. Age is a massive primary factor. The vast majority of colorectal cancer cases are diagnosed in patients older than 50 years. However, doctors are currently seeing a deeply alarming, unexplained rise in aggressive colon cancer cases among much younger adults and millennials. Your family history also plays a critical role. Having a close relative with this disease significantly multiplies your own personal risk. Genetic conditions can dramatically increase your vulnerability, making early and frequent medical screening absolutely essential for your long-term health and survival. Your daily lifestyle choices and dietary habits heavily influence your colon health, impacting your overall risk profile in very significant ways. Diets that are extremely high in heavily processed meats and very low in fresh fiber create a dangerous environment for tumors. Lack of physical exercise, chronic obesity, heavy alcohol consumption, and smoking cigarettes all heavily contribute to accelerating this deadly disease process. Taking proactive steps to improve your daily nutrition and maintaining an active lifestyle can effectively help protect your vulnerable digestive system. Prevention and early detection are your greatest weapons against this incredibly stealthy and highly dangerous form of internal digestive tract cancer. This brings us to the crucial importance of early screening, specifically utilizing the highly effective and convenient FIT test at home. The fecal immunochemical test is a simple, painless screening tool designed to detect hidden microscopic blood traces hiding in your stool. You can easily complete this quick test in the total privacy of your own bathroom without any complicated medical preparation steps. Catching colorectal cancer in its earliest stages through routine screening can dramatically increase your overall survival rate to 90% easily. Do not wait for severe symptoms to appear. Talk to your doctor about scheduling a regular test or a preventative colonoscopy. Taking this one simple preventative step could absolutely save your life and keep you healthy for your family for many years. Thank you for taking the time to learn about these critical health signs with us. Here on the Video Creator channel, stay vigilant, listen closely to your body, and never ignore warnings. Goodbye from Video Creator, your truly trusted health information source.